Patel, the surgeon as well?
Yes, we did meet
Okay.
him.
And what do you think, or what are your questions or concerns?
Well, like anyone else, I'm apprehensive about that kind of surgery.
Mm-hmm.
But I'm relying on the fact that you and Dr. Patel think I'm a good candidate for it.
Yeah.
And that all of my tests and results and negative things and vitals are pretty good. And that my attitude towards life and the future are good. So
Right.
I guess I'm kind of relying upon your judgment, although I know you can't tell me what to do.
Right. And then, how's the bruising? It's been okay on the Plavix?
She's bruising.
Yeah.
Well, that's,
So, two sort of separate concerns. One, about the procedure itself. So it's done with anesthesia, not deep, but it's anesthesia, so
I
unconscious.
understand that, yeah.
And then we put tubes in the groin, but these are bigger tubes than the usual ones. So one is as big as this.
Wow.
And through that, we put a new valve within your old valve. We are not taking out the old valve. Wherever the old valve is, we put a new valve within it and expand that. And that takes about an hour. And then you have a pacemaker, so we're not too worried about it because we put a temporary pacemaker wire, pace your heart rate fast, and after that's over, we take it out because you don't need it since you already have a pacemaker, so that should be okay. The risks mainly pertain to bleeding here or having problems with blood flow to your leg. Then there's a risk of bleeding around your heart, which is different. And then there's a risk of stroke, of heart attack, and of needing open heart surgery if something goes wrong. So did Dr. Patel discuss the risk of open heart surgery or explain that to you? What did he say?
Oh, I don't remember.
I don't think he said much.
Yeah,
He
I
just
think.
said it was a risk. I understand. The problem I have is the risk is if I don't do something. I
Yeah,
guess.
well, so the other issue is when things go wrong, which are rare, but they can, then we don't have time to talk to you because you're unconscious and we just proceed on to whatever is to be done depending on a
Right.
discussion beforehand,
Right.
knowing what your wishes would have been. We will certainly update her, but it's not like if there's a misadventure, I can reverse the anesthesia, wake you up, talk to you, and then
Right.
decide what to do next. We'll have to just, go along with what your judgment is.
Yeah.
Yeah, that's one. And so the valve looks like this. It's a metal mesh, a stem
Mm-hmm.
with a tissue inside of it.
Mm-hmm.
It is crimped and then it goes through the tube and then expands to sit around the valve like this. So there is sometimes leakage on the side of it because we're not taking your old valve out, we're just putting this within it.
All right.
And this is a perfect circle. Your valves are never perfect circles, so there's always a little bit of misalignment. So if there's a little bit of leaker on the side, it usually has no impact and you'll be fine. It's anything more than a little that can cause problems. The other issue is you do have another valve that is leaking backwards, and that's the mitral valve. Now that is not impacted by this, meaning you will have some improvement in symptoms in terms of breathing and tolerance of activity, but this is not the only valve that is degenerating. The other valve is not severe at this stage, so we're not doing anything to it. This is the one that is severely narrowed. The other one has backflow or leakiness, and that will just wait and watch. Down the road, if that gets to be a problem, we'll have to see depending on what sort of a backflow or leakiness it is down the road.
Well, you're telling me no matter what we do, I could have a very short life and not enjoy it.
No, I didn't hear that at all.
I'm just telling you that no matter what we do, I'm not the one giving you guarantees on your longevity.
I understand that.
That's all I'm saying.
I'm just saying I'm going on your judgment as to whether I'm a good candidate for what you're going to do, based on what you know.
I think at 93, this would be the only way to fix your aortic valve, and we would do that. I'm being realistic with what you expect afterwards. I don't expect you to feel like she does.
Well, I don't either.
Right.
No.
Right, because a lot of people are focused so much on this, thinking that after this they'll feel 20 years younger. That is
No,
not the case.
that's-
I just want to be,
No,
you're
I'm just looking forward to as many good years as I can have with a fairly good quality of life, which is
Sure.
what I have now.
sure. And you live where? Which town?
Pardon me?
Where do you live?
Cedar Falls.
Oh, you live in Cedar Falls.
Seafall.
then usually after the valve, we keep you overnight.
Yes, I
And then
understand.
the next day we do an ultrasound again,
Right.
and if it's looking okay, we release you home the next day.
Oh,
You have a bed rest for about 6 hours, and we want to get you up and walking so you can get some of your strength back quickly after the
understand.
anesthesia.
yeah.
And then we talk about doing cardiac rehab, which is the exercise program to sort of get you into a better condition after the valve, because I think that actually helps a lot with people feeling better with the valve procedure, because they make you walk and they make you do some exercising. So that'd be the way to go. Did you do labs just a few days back or today or something?
Yesterday.
Yesterday, let me see those labs. So those would be to check your kidney function and, INR 1-3, and kidney function is okay, your potassium is good, your heart failure number is still up, which we know it would be up because of this valve, and you had a hemoglobin done of 9.8, so that's your blood count, so to speak. Previously it was 9.3, so you're staying at that range. And then she did a urine test. You got a trace bit of bacteria, sort of a thing in your urine. Do you have any urinary infections in the past, or have you had anything?
Not that I remember.
Mm-mm.
For
Okay.
any-
No.
No,
Do you take any antibiotics as such?
no.
Okay. Well, then if you're not, it was only a trace thing. I don't know if it's a contaminant or not. We'll just leave it be, because all the other numbers seem to be okay in your case. Okay, then, do you have any questions? I'm sorry.
Yeah, I do. So when she's recovering, does her heart actually hurt? Like the heart itself, or is it just more the groin area?
It's usually the groin area. Some people can get chest pains because when we are putting in the valve, we're also obstructing flow. But as such, it's not a painful procedure to the heart.
Okay.
But some people do get a sense of pressure or fullness depending on how difficult it was to put the valve in and things like that.
Okay. What about you, Mom? You had some questions.
I don't know. I'm just.
Her water pill,
Uh-huh.
you guys doubled her water pill, and it's going to run out soon. And Lisa was the one originally.
How soon is soon?
How many?
I don't know. I don't want to have. You told me to take 2, and the prescription is automatically refilled. So I still have some in there, but when the time comes that they automatically refill it, they'll only give you 1 each day, and I take
Right.
2 a day now.
So she's going to run out before the refill.
Right. But are you going to run out before the valve?
You going to run
No,
out
I
before
don't
next
think so.
Tuesday?
Okay, then that's okay, because we will make changes after your valve to the water pill dose depending on how you're doing.
Okay.
So then if you have enough till Tuesday, then I'd say don't do anything. After that, once we discharge you from the hospital, may have to adjust the dose and take care of the prescription. then.
Okay. Mom, let me see your list. What else do you wanted to ask something
That
else?
was the main thing about the water pill.
Oh, so when she gets her procedure done, I want to spend the night with her in her room.
Yeah, absolutely.
Oh, thank you so much.
There's a little pull-out couch that most of those rooms have upstairs.
Yes.
Yeah, that should be okay.
And
Thank
then
you.
in the anesthetic, whatever they give me,
Mm-hmm.
and it helped me last time,
Mm-hmm.
put in
The
that
Zofran.
anti-nausea meds.
The
The
Zofran.
IV thing.
Yeah, so the anesthesia person will come and talk to you before the procedure, because I can't tell you who it's going to be.
Yes, I know.
And then they will come and take consent from you for the procedure, so they'll describe their anesthesia thing and all that. Just tell them then. So
Yeah.
that person that day will just set it up
Right.
for you.
Okay,
That
thank
shouldn't be a
you.
problem.
And we are begging you guys, can you do her procedure first of the day so she's not waiting and waiting and waiting?
Sure, I can't promise you, because what that hinges on, unfortunately, is who the other people are.
Yeah.
So it is based on the distance that they have to travel to come here, and also is their procedure more complicated.
Ah.
So sometimes you go through the carotid artery, sometimes you go through the shoulder area.
Mhm.
Those are more complicated, so we tend to do them first rather than the simpler procedures which we do later.
I
I get
see.
So we can try, but I just can't sort of guarantee you depending on who the others are
Yeah.
that day.
Okay.
But yeah.
Tell those guys to come a day early. No, I'm just kidding.
No, it's not that. It's the sequence of procedures.
No, I
So
get it. I was
even if
just
they come a day
kidding.
early, they still could be ahead because it's a more complicated procedure. So we'll do those first.
Okay. I can't think of anything. Are there any new medicines that she'll have to take?
No, and so they'll call you the night before, telling you, when to show up and all that. We'll have you hold that blood thinner, that Eliquis, okay? We'll have you hold that 2 days before.
The nurse is gonna print that
Give you
out
the
for
rest.
me, yeah.
But I want you to take that clopidogrel or that Plavix that morning as well.
All right, and aspirin too?
I don't care about the
No.
aspirin so much because we'll put you back on that Eliquis the next day or so.
Okay.
I don't really care. But yeah, just wait here. I'll have her come and give you the instructions in writing. And I'm sure you'll have questions or thoughts for me as I walk out or later
Okay.
when you go home. So just write them down and I'll see you that morning as well.
Okay.
And then we can answer them, okay?
All right. Thank
Good.
you so
Thank you.
much. Appreciate
Just wait
it.
here. Should be over soon.
All righty. Have a good rest of your day.
Oh, thank you. It shouldn't be too long.
I don't know.
All he said was about your regurgitate or your mitral valve thing.
The other
That's in a mild situation.
I know that. It's
Yeah.
just all the rest that they, if things go wrong, they can do, they'll have to do.
That's
all
for
that.
anybody that they do
That they
this.
do it to.
Yes, everything he's telling you, he tells every
I
single,
understand. He said it before.
and the risk is low.
Yeah.
If it was a high risk, they wouldn't even do it
No, I don't think so either.
because it wouldn't make sense.
No. Well, you think I'll feel better afterwards with all this going on?
I just don't think you'll be as tired.
But is it worth going through all that just to not be tired?
That's up to you.
I don't know.
See, I don't know if it's worth it or not. Because eventually your mitral valve or whatever's going on,
Go.
eventually, but you probably have a few years before you do this procedure again.
I don't know what to do.
I know, Mom. You know what? You don't need to make up your mind in stone right now.
Well, we only got 5 more days.
We'll take advantage of it. Because you can back out at the last minute.
Oh, yeah. You know, I wish I could talk to Lisa because I feel so comfortable talking to her.
When we leave here, we can walk out and see if she's available, okay?
Maybe I bet she would talk to me.
Yeah, she would. If she has a moment, she would. So we'll ask to see if we can see her.
If I don't do it, I could live, what, a year or 2 years or maybe more.
Yeah, maybe more.
Nobody knows.
No. Could live 5 years. I mean, nobody really knows.
So is it?
Because they don't know how fast their stenosis grows as far as closing. Come on in.
Alrighty, here's a copy of your
Thank you
instructions.
so much.
There was one change. He said you can take the metoprolol the morning of procedure, so I deleted that one.
Okay. I have a question for you. Do you know Lisa?
Yeah,
Does she have a second? Mom really would like to talk to
I can see if she's
Okay.
here. What is today?
Wednesday.
I think she's in West Union.
Oh,
Outreach
bummer.
Clinic, but I'll go look and
You're
see if
so
she's here.
sweet. Thank you.
You know, I've been a patient of hers for years.
Yeah.
And I've developed a good, warm relationship with her. Maybe it's a woman to woman. I think that's part of it. And right now, after today, and talking to him and all this, I'm thinking, I wish I could just talk to her. I wonder if she would have any time, like another day or another time. that
Yeah.
I could-
Let me go see if she's here. I think
Thank
she's in
you.
West Union today.
Okay. But if you want to come back and talk with her, we can schedule an appointment with her.
Yeah, just a few minutes.
Yeah.
maybe. 'Cause she
But you
could
might not be able to get in before.
Oh, I know, but she can see my records.
What do you want to say to her? Mom, what do you want to say to Lisa?
Well,
What do you want to say to Lisa?
just want to talk to her and see what she thinks, whether she thinks I'd be a good candidate. Well, obviously they do. I don't know, right now I'm just so confused. I'm out of it. I just don't know what I want to do.
I know, Mom.
No, you can't possibly know how I feel.
You're right.
As much as you're in empathy with me, you just can't know.
I can imagine.
Imagine, yeah. Well, c'est la vie. You want to hold that? I'll put
Sure,
it-
Mom. Yeah, the night before I can give you a little sponge bath.
No, don't want to be bothered.
I don't mean now, today. I mean the night before.
We'll see.
Okay.
I suppose I just ought to go for it and hope for the best.
I know, that's all you can do. I think. Hi.
Okay, yeah, she's not here. She's
Okay.
at her West Union clinic
You're so
today.
sweet. Thank
Yeah.
you.
Yeah. All right. Well, you guys are free to go.
Okay.
Yeah.
Thank you.